All right, 608-270-9933.
And 3 lines open if you have a question for Dr. Zorba Paster.
Sitting right here waiting. So let's get to the calls. We'll start with Terry in Watertown. Hi, Terry.
Hi. I've had the hiccups every day for I don't know how long, 5 times to 7 times a day. What is wrong with me?
They make you so tired.
Well, first of all, there can be a lot of things that are wrong, but hiccups in and of themselves can be terribly devastating. And there are some medications that you can actually get from your doctor to decrease hiccups. There's some medications that are actually major tranquilizers that are used for schizophrenia and others that in small doses can be used for hiccups. Thorazine, which is an old-fashioned drug sometimes that's used. Chlorpromazine, which is also used for nausea, can make a difference. And so if you're having hiccups like that, you really want to talk to your doctor to find out whether or not there's something you can do. And sometimes there's a workup for that to find out exactly why the nerve that's along the diaphragm is actually causing your hiccups to occur.
That's what
very
causes it?
disturbing. Yeah, it's the nerve that's all of a sudden. You remember babies always have these hiccups. They're like hiccuping all the time until that nerve gets fully developed. So it's terribly disturbing, awful.
Yeah, my dogs do it all the time as well. All right, let's go to Carly. Hi, Carly. What's your question?
My question is, I got a booster, the upgraded booster, back in September. I want to know how long is this going to be effective and how long is it going to be before I need another booster?
Well, it's a good question. So first of all, its effectiveness is right now. So in other words, you got your booster shot, it's effective. And remember, if you haven't gotten your flu shot or your booster shot, now is the time to do it. 2 weeks later, you're really going to get that boost. And only 30%, 35% of the people in Wisconsin have even gotten their flu shot, who should be getting their flu shot. So it's important. But as far as we know, it's effective for this season. And are we going to need one every year? Well, that's a good question. My guess is yes. I think flu shots, COVID shots are going to be something that we do on a regular basis. The best way to prevent getting COVID is getting immunized. The best way to prevent dying from COVID or ending up in the ICU is getting immunized. Immunized, immunized, immunized. I know we don't like to go and get those shots, but come on, folks. It's easy to get. The pharmacies are ready, easy to get them.
All right.
So you should get a shot, is what you're saying.
Yeah, exactly.
Okay, thank you.
And you can get them both the same day, too.
Let's go to Mary in Richland Center. Hi, Mary.
Hello.
Hi, what's your question?
Yes, I take blood thinners, and I'm wondering, am I able to donate blood?
The answer is you have to call the Red Cross. They will tell you whether or not you can do that or not do that. Certain blood thinners, for the most part, if you're on warfarin, you're not allowed to donate blood. I'm not sure about the DOACs, the newer blood thinners, but you have to call them up. They have a list of drugs that you cannot be on if you're actually going to donate blood.
And so don't stop taking the blood thinner.
No, no, no. Do not stop taking the blood thinner. Definitely call the Red Cross, right?
Okay. Any big New Year's Eve plans?
Thank you.
Thank you for calling.
Thank you for calling. Happy New Year.
You know something? We are going to stay at home, have our friends over at the house, our daughter's in from out of town, and that's going to be our wonderful New Year's Eve. I'm not going on the road. I'm not going to, go out and get inebriated.
We have dinner reservations at 4:45.
Oh.
We'll be home by 6. Happy New Year's, Zorba.
Happy New Year's,
Thanks for your calls, everybody.